Hi, everybody. I'm Ellen with Advanced Massage Therapies here in Carrollton, Georgia, and we're back with Megan Shea Rogers. Say hi. And on our last visit, we decided to work with Megan's cranial nerves and her brainstem. She has been experiencing dry mouth as a result of taking Keytruda, and dry mouth and dry eyes can be caused by as a side effect of taking Keytruda. And so in just one session, we got amazing results. So Megan's going to tell you a little bit about what was going on and how she's doing now.
Yeah, so as Ellen mentioned, the Keytruda, I actually only had 2 doses of the Keytruda and they ended in December, but my dry mouth symptoms started at the end of March. So it was a little bit of time that lapsed between the symptom and the actual, drug. And so, or side effect rather. But the dry mouth got so severe. My lips have been so severely cracked they would bleed, almost like they were in winter. I would put everything on it. I've tried like tallow, multiple types of moisturizers like Aquaphor and some CeraVe. And then my mouth was so dry that I'm not able to have a conversation like this. Like I've not been able to even talk. There's been times I've been laying on Ellen's table and we had to just stop for me to get water because I couldn't lay down and breathe because I was so dry. Um, I've been using sleep aids like the things, what are they? The xylitol that stick on your mouth. And I've been chewing anywhere from like 5 to 6 pieces of xylitol gum a day to where it gave my tongue ulcers on the back. Um, and then like just other little things like I just can't create spit, so I can't spit anything out of my mouth. Like if something were to taste bad, and then along with that, I know it's an after side effect a lot of times that you taste something very metallic, or your taste begins to, turn into very metallic. I guess I don't really know how to say that, but after chemo, it's a side effect. And so I did start to develop that at the same time in conjunction with the dry mouth. And so Ellen did some stuff, like she mentioned, in those areas, and there was just like probably like 20 minutes into the session, the back pockets of my cheeks, we started to finally develop saliva, which has not happened in 2 months, almost 3 now. And since that session, I've been able to sleep with no xylitol melts in my mouth. I have I've been down to like 2 and 3 pieces of gum a day, which is significant. There's no more ulcers on the back of my tongue. And I was telling Ellen, it's kind of funny to talk about on camera, but I noticed that I could whistle last week, and people don't think about it. But I had told her, I said, we have farm animals and we have dogs, so we whistle a lot, and I was able to whistle, and that was pretty cool. And in the mornings, you'll get up to brush your teeth, and sometimes you just have gross in your mouth. But I've not been able to spit that out since March 12th. I've not been able to spit. And that's kind of crazy to not be able to just spit. And so I've been able to do that the past 2 weeks. Or what was it? Was it like 10 days? I think I've seen you 10 days ago or so. And I've been able to get up in the morning and spit. And I'm talking to you right now, and I haven't really had the cottony. So it's just been a really big, significant improvement over the last few days with this. And I would say it started getting better within the day that she worked on those nerves. Was it a nerve you said?
I worked on certain cranial nerves,
Yeah.
which control saliva production, and then I also work with the nuclei in the brain, which control those specific nerves. So cranial nerves come directly out of the brain. They don't come out
Yes.
of the spinal cord, hence why they're called cranial nerves.
And I also know that with a lot of people get dry eye or dry mouth after chemo. But I also know that they put me on hydrocortisone because of my adrenal crash. So that's another side effect of steroid usage. And right now they've got me on 20 milligrams a day. So that's a suppressive amount for the adrenals, and Ellen's working on the adrenals. But yeah, I refuse for all these things to be permanent, and we've got a good team. Ellen's a part of the team. Right now,
Yes.
she's the team captain of Spit.
Well, we wanted to make this video because I feel very certain that you're not the only person in the West Georgia area who has had these effects from chemotherapy, Keytruda or other drugs. And if you're watching this video and you know someone who's been affected by this, please have them reach out to me. I can possibly help them. Of course, every individual is different, results may vary, but it does affect them neurologically. It also causes a lot of congestion and it affects the tissues as well. So I'm working in a multifaceted approach with this. It is very gentle, very relaxing. It's an osteopathic manual therapy that I've been doing for many years. And it's just great because I've had these seemingly little miracles happening in my office for years. I just haven't been able to get them out on video. And I always have them happen, and I was like, oh, I wish we had gotten that on video. So here we go. We've got it on video now. And please, if you're watching this, do share it. I know that there are people out there who need this help, and they don't maybe realize that there's help to be had. So I'm going to start doing a little bit of therapy on Miss Megan, and we'll check back in after the session.